Today I'd like to talk about one of my favorite topics, namely heartworms. And yes, they do live in the heart. Now, I don't know if you can see this very well, but this is a canine heart, and these little spaghetti-looking things here are in fact the adult heartworms, and it's the adults that actually cause the problem. Okay, now, the whole cycle of the thing is that you have these adult heartworms inside the canine heart. They're going to produce just millions and millions of microscopic baby worms called microfilaria. They're going to be floating around in the bloodstream, just waiting for a mosquito to come along, bite the dog, suck some blood up, and take them with it. They actually have to pass through a mosquito for a few days in order to be able to continue their life cycle and become adults in the next dog. And that's what happens. After a few days in the mosquito, they will actually, when the mosquito bites another dog and they're ready, they will swim against the flow of blood down the mosquito's mouthpiece into the new dog, get into the bloodstream, travel through the body for a few months, go through a couple of molts as they grow, finally wind up on the right side of the dog's heart as adults, and then that's when they start producing the problem. Okay, they will, of course, start producing more worms, making that dog infectious to other animals, other dogs. One or two worms is not typically that much of a problem. It's when you get multiple worms, just like in this case, hundreds. They will actually block the blood flow through the heart. That will cause the blood to back up. You get increased blood pressure. It will back up into the lungs. That's why a lot of times coughing is a very common symptom of heartworms. They can cause a lot of things, damage to the liver. They're just bad news all around. Okay, now what are symptoms of heartworm disease? Well, I mentioned one, coughing. That's the most common. But weight loss, exercise intolerance, or just as we like to say, ADR, ain't doing right. You know, the dog just not healthy looking, doesn't act right, but yet there's nothing specific. And typically in this part of the country, what we will do is, as part of an examination of a dog, if we're not really sure what's wrong, we will do a heartworm check, even if the dog is on preventative, just as precaution. Now, your dog has heartworms. Okay, how do we know that? There's a blood test that is very simple, very fast. Takes about 10 minutes, takes only a few drops of blood. We can do that here in the office. We can make the diagnosis, then we can treat the dog. And treatment is so much better now than it used to be. Back when I first started practicing 30 years ago, the only treatment that was really practical was a drug that was related to arsenic, had to be given intravenously. It was very toxic. It saved a lot of dogs. Don't, give it its due. Don't criticize it too much. But it was very rough. It was very rough on the dog. Had to be very careful giving it. It had to be given intravenously if it got outside the vein. It was very irritating to the tissues. Nobody liked it, but it was all we had. For about the past 20 years or so, give or take, there's been a new drug on the market, so much nicer. We give it in the muscle of the back. We don't have to go intravenously. Has fewer side effects. It's not near as toxic, and it's very, very effective. We give it in the muscle of the back because it can cause some muscle soreness. If you give it in the leg, the dog typically will not be able to walk for a day or two, or walk very reluctantly. You give it in the back, at least they can get up and move around. That's the main side effect with that, simply muscle soreness. Now, typically about a week to 2 weeks after the treatment, I always warn people that your dog may start showing some symptoms. It may start coughing, may go off its feet for a few days, and typically dogs treated for heartworms will lose a pound or two, simply because they lose their appetite. This is not necessarily from the drug, this is from the effect of the heartworms themselves dying. You see something there that's the size of small spaghetti. It's in the heart. It can't be passed from the body when it's dead, say like an intestinal worm. It dies, it has to be digested by the microscopic white blood cells. So you have these little microscopic blood cells that are having to eat something thousands and thousands of their size. The worm a lot of times will break apart, and these little pieces of dead worm will circulate around in the body, through the bloodstream, and if they happen to land in a bad spot, they can cause some side effects. As long as they don't all hit at one time, typically the dog can handle them. Then once the dog is treated, we can put them on preventative. Or if the dog has never had heartworms, then we can put them on preventative. Okay. Typically, we like to start dogs on heartworm preventative at 6 months of age. The reason being, we know that if the dog was bitten by a mosquito on the very day it was born, it will not have adult heartworms at 6 months. It takes about 6 months from the day of the bite to the time that you have the adult heartworms. The preventative works by killing the baby worms as they come into the animal so that they don't ever grow up to be the adults. The babies, the microfilaria, are not the problem. It's the adult heartworms. So the preventative can be started at 6 months of age. After that, we like to do a blood test, make sure the dog doesn't have heartworms already. The test actually tests for the presence of the adult heartworms. Why do you do that? Well, typically because we don't want to give the preventative to an animal that has the adults, because you're not really doing that much good. You're preventing further infection, but you're not doing anything for the one that they have. Now, at one time, we could do what's called a slow kill. We would, sometimes if the dog was not showing symptoms, we found the infection just simply by routine exam, we would put them on a preventative to keep them from getting further heartworms and let the ones that are there basically die of old age anywhere from a year to 2 years. And we would monitor the dog every few months until we get a negative test and everything's fine. The experts now, specifically the American Heartworm Society, doesn't like us to do that anymore because they're afraid that what we're doing is developing resistance in the adult heartworms to the preventative. And what's happening is they're passing that through to the microfilaria, and the microfilaria aren't being killed by the heartworm preventative, so it's doing no good. So we generally try to avoid doing the so-called slow kill. The preventatives, there's 2 or 3 on the market now, 2 different kinds of preventatives. Typically they are a once-a-month tablet. There is an injection available that lasts for 6 months. They all work very well. So far, we haven't had any problem or anything. People ask me which one is the best, and I tell people that's up to you. Whichever one suits your circumstances. They all work if they're given. None of them work if they're not given. So I tell people it's what you are willing to do. There are some that are the so-called generic heartworm preventative. It's very cheap. All they do is prevent heartworms. There are others that have added ingredients with them that will take care of other types of intestinal worms. There's even one that will take care of intestinal worms, heartworms, and kill fleas. Obviously, the more things they do, the more they cost. So I always tell people, it's up to you. It's what fits your circumstances and your needs that determines what heartworm preventative you put your dog on. All of them work, as I said. They all work. They have to fit your circumstances. And the nice thing is they're interchangeable. If you start off on one, you decide that one's not for you, later you can switch to another one. It's no big deal, okay? People think that, there's going to be a problem. No. If you don't like the one you're on for some reason, or you hear of another one that you think would suit your purposes better, you can switch later on, okay? Now, a question that I often get is people will ask me, can I get heartworms? Well, yes and no. Yes, you can be bitten by a mosquito that has heartworms, and yes, the microfilaria will come into your body. That's bad news for the microfilaria. They cannot live inside human bodies for the most part. The chemicals are all wrong, everything's wrong. They usually last anywhere from a few hours to a few days, then they're dead. Your white blood cells chew them up. You never knew you had anything. Occasionally you will have somebody who ends up through bad luck or whatever, or a very tenacious heartworm or whatever, will wind up with a heartworm. Usually they're found, I remember a case a few years ago where some lady was having coughing, went to her doctor, x-rayed her chest, found a mass in there. took her to surgery, took it out, sent it to pathologist, and there was an adult heartworm curled up in there with the scar tissue all around it. Interesting, but not that big of a deal. You're probably more in danger of getting hit by an asteroid than you are catching heartworms from your dog. And again, you can't catch them directly from the dog, you catch them from mosquitoes, okay? The points to remember are, they are easy to diagnose, they're even easier to prevent, and yes, they can kill a dog. There's really no reason in this day and age for a dog to come down with heartworms unless it's just somebody just simply did not put them on preventative. So that's the basics of heartworms in dogs. Enjoy.